What to expect from your first period after pregnancy. What to expect from your first period after pregnancy. From glowing skin to a newfound appreciation for your body. There are many things to love about pregnancy. Another is that you'll have at least 9 months of freedom from your period, but after you deliver, you're probably curious. What will happen with your menstrual cycle? When your period returns often, depends on whether or not you breastfeed, and just like your life after baby. You might find your periods after pregnancy are somewhat different. Your postpartum period may be different from what you're used to. It may be heavier, involve more cramping, or come later than expected. When will my period return? Your period will typically return about 6 to 8 weeks after you give birth, if you are breastfeeding. If you don't breastfeed, the timing for a period to return can vary. Those who practice exclusive breastfeeding might not have a period the entire time they breastfeed. Exclusive breastfeeding means that your baby is receiving only your breast milk, but for others, it might return after a couple of months, whether they're breastfeeding or not. If your period does return quickly after giving birth and you had a vaginal delivery, your doctor might recommend that you avoid using tampons during your first menstruation post-baby. This is because your body is still healing, and tampons could potentially cause trauma. Ask your doctor if you can return to using tampons at your 6-week postpartum checkup. Why don't breastfeeding women get their periods as quickly? Typically, women who are breastfeeding don't get their periods as quickly because of the body's hormones. Prolactin, the hormone needed to produce breast milk, can suppress reproductive hormones. As a result, you don't ovulate or release an egg for fertilization. Without this process, you most likely won't menstruate. Will my period affect my breast milk? When your period does return, you may notice some changes in your milk supply or your baby's reaction to breast milk. The hormonal changes that cause your body to have your period may also influence your breast milk. For instance, you might notice a decrease in your milk supply or a change in how often your baby wants to nurse. The hormone changes might also affect your breast milk's composition and how it tastes to your baby. These changes are usually very minor, however, and shouldn't affect your ability to breastfeed your baby. It can also take some time for your cycle to regulate after birth. You might find that you have your first period, skip a cycle, and then have another period that comes sooner than expected. During your first postpartum year, it can be normal for your periods to fluctuate in length, time between cycles, and intensity of bleeding. This is especially true if you're breastfeeding. Most postpartum women will have a normal menstrual cycle of 21 to 35 days with bleeding that lasts 2 to 7 days. Period cycles can change from what you experienced before pregnancy. What postpartum symptoms should I watch out for? It's important that you call a doctor if you experience any of the following symptoms. Soaking through more than one pad every hour. Bleeding that's accompanied by sudden and severe pain as sudden fever. Bleeding continuously for more than 7 days. Blood clots that are bigger than a softball. Foul-smelling discharge, severe headache, trouble breathing, pain while urinating. Contact your healthcare provider if you experience these symptoms or anything else that concerns you related to your period, as some of these symptoms may indicate an infection. Like, share, and subscribe to Toki's Kitchen.